Okay, well, we're going to get started. So hello and welcome. My name is Julie Schumacher-Cohen, and I serve as a member of the Catholic Advisory Council of Churches for Middle East Peace. And I'm glad to be moderating today's panel with Jeff Aboud, who is chair of the council. And so together, he and I will be trading off as we introduce the webinar and our speakers, and also engage in some Q&A, including questions that you all can offer. So I know many of you are probably skilled with webinars these days, but you can do that through the Q&A function, and you can do that at any time throughout the webinar that you might have questions for our speakers. So first, those of you who may not be aware, Churches for Middle East Peace, or CMEP as sometimes we call it, is a coalition of more than 30 national church communions and organizations working to encourage U.S. policies that actively promote just, lasting, and comprehensive resolutions to conflicts in the Middle East. CMEP works with church organizations, leaders, individuals nationwide to advocate in a knowledgeable, timely, holistic, and effective way to express their concerns about justice and peace for all peoples in the Middle East. Today's webinar was organized, of course, because of the ongoing suffering taking place in Gaza and the West Bank, to talk about the humanitarian and health realities that are facing Palestinians, and to have a chance to hear in particular from two Catholic development agencies. So we are so glad to have Bill O'Keefe from Catholic Relief Services and Shireen Khamis from the Caritas Baby Hospital joining us from Bethlehem today. And they're going to be talking about the work that their organizations do to try to alleviate these hardships. So we're looking forward to gaining a better understanding of what is currently happening on the ground, what can be done to prevent things from getting worse, the acute challenges and barriers to providing humanitarian aid and healthcare, the necessity of a permanent ceasefire, and how we can have a positive impact on the current realities and toward a just peace in Israel-Palestine. I want to note that it has been now over 200 days since the horrific attack by Hamas in southern Israel on October 7th. And since then, Israel's military assault that has wrought widespread devastation on Gaza. More than 35,000 Gazans have been killed. An estimated 70% of those are women and children. Mass displacement, starvation, lack of medical access, and the destruction of 70% of housing is making Gaza increasingly uninhabitable for its civilian population. And in the West Bank, Israel's longstanding occupation has been further entrenched since October 7th, with more restrictions on freedom of movement, as well as a rise in settler violence. And in the last 6 months, more than 300 Palestinians in the West Bank have been killed, and thousands have been imprisoned by Israeli authorities. So while the focus has necessarily been on Gaza, in today's webinar, we also wanted to highlight how life for Palestinians in the West Bank has become all the more difficult. And in both cases, in Gaza and in the West Bank, the work of organizations, international and local, to address the needs of the Palestinian people has only grown more dire and more challenging. And it's ever more important that we hear from these organizations firsthand. And so now let me turn to my colleague, Jeff. He's going to share a little bit more about the work of the Catholic Advisory Council and also introduce Shireen. I will then introduce Bill, and then we'll get started with some opening comments.
Thanks, Julie. Good morning, everybody. My name's Jeff Aboud. I'm currently chair of the Catholic Advisory Council for Churches for Middle East Peace. And while it's broadly ecumenical, CMAP's also developed a more focused initiative composed of U.S. Catholics for specifically engaging the broader Catholic community. Our purpose is to work in support of the political and socioeconomic conditions that favor the permanence of the Christians in the Holy Land. In doing so, we engage in advocacy and education among American Catholics, this webinar being one of those efforts, to promote U.S. policies that work toward a just and lasting peace. So if you'd like to find out more about our work or get involved, you can contact us through CMAP's website, cmep.org. And without any more ado, I'd like to introduce our first speaker, and then I'll introduce Julie. She'll introduce Bill, and then we'll let them speak. Shireen Khamis currently serves as the marketing and communication manager for Caritas Baby Hospital in Bethlehem, which is the only specialty pediatric hospital in the West Bank. Caritas Baby is renowned for its comprehensive treatment of pediatric illnesses, neonatal and congenital disorders, as well as patients with hereditary, neurologic, and metabolic conditions. Last year, they provided nearly 40,000 treatments for babies and children, most of that without charge. For over 15 years, Shireen has coordinated and developed various projects in Bethlehem and on a national level, having worked extensively with various local and international NGOs. She holds a degree in business admin from Bethlehem University, which is the Vatican's university in Bethlehem, and a master's in public administration from the Mohammed bin Rashid School of Government. Her expertise in governance, project management, strategic planning, media and communication contribute to the Palestinian community, as well as many other organizations dedicated to the social welfare and humanitarian causes. Now, Julie will introduce Bill, and then we'll get into there.
Yeah, and we're just going to do a quick sound check because Shireen is going to speak second. So Shireen, do you want to just make sure that we can hear you? We're not hearing you. So Bill is going to speak first. So if you want to, in the meantime, as we're going, you can work on hopefully getting it so that we can hear you, because there isn't a sound coming through. So, and if you need to just try it while we're talking, that's fine too. Just give us a little wave. It won't interrupt any of us. As we know, Shireen is joining us from Bethlehem, so we're hopeful that we will be able to get the tech working and have her be able to be heard in just a few minutes. So in the meantime, let me go ahead and introduce Bill. So Bill O'Keefe, someone I'm glad to count as a colleague and a friend. I used to serve as the legislative director of CMEP in the 2000s, and he and I would frequently visit Capitol Hill, which he's still doing with much commitment, to share the work of CRS with congressional leaders and staff. Bill started his career at Catholic Relief Services in 1987, and he served in various capacities over the years. He currently serves as Executive Vice President for Mission and Mobilization, and in this capacity, he oversees CRS's efforts to build a movement of Catholics and others of goodwill to support their global mission and build action-oriented global solidarity with poor, vulnerable, and marginalized people around the world. These efforts include lobbying Congress and the administration on a range of foreign policy issues and engaging U.S. Catholics in public campaigns to change U.S. foreign policy in ways that promote justice and reduce poverty overseas. CRS operates programs in Jerusalem, the West Bank, and Gaza in the areas of agriculture, emergency response and recovery, food security, justice and peace building, and partnership and capacity strengthening. And in his capacity, he's traveled regularly to the Holy Land and the broader Middle East. And he did his undergraduate work at Yale and holds a master's in public policy from the Kennedy School of Government at Harvard. So we had asked our speakers to open up with a kind of a framing question. And so basically, really, what are the health and humanitarian realities in Gaza and the West Bank that you feel are most urgent for us as Americans to grasp at this moment? Obviously, many of us are seeing things in the news daily on our phones through the reach of social media, but we're excited and appreciative to be able to hear from you all directly. So tell us a little bit about your agency's work and the challenges that you're facing. So we'll start off with Bill. Shireen, did you want to try to test it one more time before we, or you're doing another? Still not hearing here, but I see that maybe a colleague is joining in another way. So Bill, why don't you get us started, and we'll hope that Shireen will be able to join us in just a few minutes.
Great. Well, thanks so much. And Shireen, if need be, I'm not the marketing manager for the Caritas Baby Hospital, but I was there 2 years ago, and I can tell you I'm on your team, and I was incredibly impressed. So happy to step in if the sound doesn't work. Let me just say first, I want to kind of start with the fact that in spite of what you see on the news, which is horrible and tragic, and I'm going to get into that, we at CRS and certainly other humanitarian groups are able to provide assistance. CRS has so far helped 600,000 people in Gaza, including over 500,000 people with food, 23,000 households with multi-purpose cash assistance, which is basically this really cool electronic voucher program that allows vulnerable families to buy their own supplies in the limited market that still exists in Gaza. We've provided over 12,000 families with bedding and other shelter supplies, hygiene kits, and tents. We are actually expanding our operation in spite of the ongoing conflict there, and now have staff and operations in Rafah, in Dar al-Balah, which is in the middle, just kind of above Rafah. We have returned to Khan Yunis in the middle area, and are supporting church compounds in Gaza City, and I'll talk a little bit more about that later. So the first thing I just want to say is, there's a lot of good work going on, and I'm very proud of our colleagues at CRS for the work that they're doing. I was last in Gaza 2 years ago, and at the time it was shortly after the beginning of the Ukraine war, and I was meeting with all our staff. We have about 50 staff in Gaza. We're meeting on the rooftop of the building where we used to have an office in Gaza City. And if you've been there, the Israeli drones are buzzing up ahead, overhead. And, there's always kind of this very weird feeling there of being watched. But I was asked to give an update on our operations around the world, make connections, thank them for their work. And then I was asked to talk about our work in Ukraine. And so I launched into the wonderful work we're doing supporting Caritas Ukraine there under great stress and pressure. And I was interrupted by one of our Gazan staff who said, just a second, Bill, we met before you came, and we want to volunteer to work in Ukraine because we know how to get stuff done while being bombed. And I tell you that story to humanize and show the passion and the commitment and the depth of empathy of our Gazan colleagues and the Gazans that I have met. It's, to me, the group of people around the world who have most said yes to life. And I just want to start by kind of laying out that positive. Now, on the ground, unfortunately, and Julie covered a lot of some of the basic statistics, but the UN has assessed that famine conditions already exist in the north, that almost the entire population is food insecure. And that's actually never really happened before, where you have an entire population that's food insecure. In every other situation you think of, Ethiopia in the 80s, Somalia, there's always people who are able to produce enough food, are able to provide for their families. And in this situation, almost everybody is food insecure, and a very significant number of people are at severe risk or are already in famine conditions, mainly, but not only, in the north. And it's really kind of an unprecedented situation. I think the other thing that's unprecedented about it is just since October 7th, these 2.3 million people have been completely cut off from electricity, from much of the water supply, which comes from Israel, although there has been some opening and closing of it periodically. Very limited access to fuel, which of course powers generators and cars and the other elements of normal human life. The health system has essentially been destroyed. That's not 100% true, but you've seen in the news, and all this is accurate, that how there's been fighting within church compound and within health hospitals and health clinics that have just really left those facilities almost completely destroyed. Over 200 and something humanitarian workers have been destroyed. Most of the population has been displaced at least once. Our staff report being displaced 5 or 6 times. They started in Gaza City and they've just moved south bit by bit as the Israeli Defense Forces kind of move their way through the Gaza Strip. You have a population that's been traumatized. You can imagine we have our staff. We had at one point 2 months ago, we had 5 pregnant and lactating women who were on our staff. Many of them had other children, so they're trying to care for children while there are bombs going off. They're very traumatized by that experience. The children are traumatized by that experience. They're living in it. They've fled a couple of times. 2 of them described how they and their children were living in an apartment with 20 other women and children. The men of the family were living out on the street. They were sharing one bucket of water between the 20 people, and a lactating woman had 8 ounces of water per day allocated to her, which is not enough if you know anything about humans and how they care for their women and how they care for their babies. So just really very, very very stressful situation. I think the other thing that's difficult for our staff and what our partners and the people who we're talking with report is just the uncertainty of the situation. This has been going on for 6 months. It's unclear where it's going to be going. The Israeli Defense Forces is saying they're going to invade Rafah, which is the kind of the last mostly intact area where all the humanitarian community is staked out, and they just feel like they have nowhere to go. There's nowhere safe, and that feeling of we've moved 5 or 6 times, and there's nowhere else for us to go, I think is really having a real impact on people in their mental health. There's a report that came out yesterday actually about mental health in Gaza, and over 500,000 people out of the 2.3 million suffering from serious mental health implications of what's been going on, and that makes a huge amount of sense. So I think what Americans should grasp at the moment is, one, there are organizations like Catholic Relief Services that are expanding and are able to meet human needs. The access is extremely limited. What we can bring in through the various checkpoints is very limited and controlled by the Israeli government. The continued violence and no place is safe impacts our humanitarian operations as well. And so it's very difficult to move around. It's to have a safe distribution, because the risk of, if you pull people together to distribute things, that will then be targeted is real. And that our government, which is beginning to say some of the right things, needs to work a lot harder to ensure that there's a ceasefire, that there is protection of civilians, protection of humanitarian workers, and access to the population. And those are the things that we've been asking for since early on in the war. Finally, and then I'll stop, I've talked to people around the world, most recently in the Sahel in West Africa, from villages where people on motorbikes with guns came in and shot hundreds of people. And I have, therefore, some sense at a base level of what it was like for the people of Israel on October 7th. And I think we have to kind of find a way to hold in our hearts and in our minds what happened there and what's happening every day in Gaza and the West Bank, and call on our deeper humanity and empathy for what that would be like as we demand that our leaders work towards peace and end this violence. Why don't I stop there?
Thank you so much, Bill. And let's see, Shireen, now if you can be heard.
Hello?
Yes. Excellent. We can hear you.
Now. Well, I prepared very well, I swear. I've been sitting behind my PC for an hour earlier, but still it didn't work properly. So good evening, everyone, and sorry for the technical delay. Thank you, Bill. I'm proud to be a former CRS employee, and I know very well your great work and efforts. I think you covered Gaza perfectly. I can add, there's a lot to be said and there is a lot to be explained, but I think now hello?
You're fine. You're good, Shireen. Oh, wait.
We can hear you.
Okay.
Yes, we can hear you.
Okay. Okay. But I think, with the limited time we have, I think what you've mentioned is already very comprehensive. Regarding the West Bank situation, 2023, even before the war, before October 7, it was the deadliest year for the West Bank for a while. It has been a very violent year, and already things were not okay, let's say. Regarding the health situation, there has been, I can describe the health situations in two ways. First, there are the immediate attacks on the healthcare facilities by the Israeli forces, and many people were, even patients were killed or injured as a result of these attacks, in addition to the harm of properties and assets. There is also the accessibility to healthcare. We are suffering from sufficient accessibility to healthcare facilities due to the imposed restrictions in the West Bank after the war. There are over 600 checkpoints, barriers between the cities and towns, between the localities of the West Bank. And this, I want to give a small example to our hospital, which receives around 50,000 patients a year, 50,000 children a year. We have lost around 6,000 patients who couldn't access our healthcare facility only during between October and December, or in the first 3 months of the war. So this is a small example on the effect of the war on the accessibility to healthcare facilities. Of course, you can add to this a lot. You can add the psychosocial effect of the war and the stress of the people are suffering from. You can also describe the insecurity of the people and their the high insecurity and the absence of hope, let's say, among the people. So this is about the West Bank. Thank you.
Well, those were very powerful presentations. Thank you. We have some questions. You can put questions into the chat. I did want to start out and ask this for both of you, Bill and Shireen. In light of the recent killing of aid workers that was been in the news so much, including those from the World Central Kitchen and the killing of CRS's own photographer and hospital staff, Bill, what are the stresses on your staff in Gaza? And Shireen, what are the stresses on your staff in Bethlehem?
Thanks. Thanks so much for asking. And I'll weave in, there's a question in the chat about, or the question and answer about who are the CRS workers in Gaza and where they come from. The our Gaza staff are all Gazans, and we are we've brought in some of our technical experts from around the world who are now there now as we are expanding, and in order to help out. But so they are experiencing the war like everybody else, and that's what is why I have so much respect for them. Is they're working while trying to figure out how to get food for their kids or their parents. They were working while trying to figure out how to get from Gaza City to Khan Yunis and then Khan Yunis to Rafah. I am very worried, and I'll say we are worried about the sort of the long-term psychosocial stress that this takes. I have heard from some of them that, frankly, being able to help their brothers and sisters is what keeps them going, and that it is a gift to be a part of the operation. In spite of the difficulty. I've also heard, it's interesting. I was talking to one of our staff about how they, one of the hardest things is that they're in a position where they're helping people, but they can't help everybody. And so even walking down the street through the sort of crowded streets of Rafah, which are just packed with people in tents, people living on sidewalks, that people are coming up to them and saying, hey, I know you work for CRS. Can you help us? Can you help us? Can you help us? And being in that position of having to say no to people who you know need the help because not enough can get in is in some ways the worst thing. So it's really difficult. We're very proud of them, I think. But as I kind of said in my opening comments too, they're facing the same challenges that many others all others in Gaza are. I mean, they're fortunate to in a way that they're employed, and of course, so many other people have lost their job and source of income. So, but psychologically, it's really tough, and we're definitely worried about them. And I would urge everybody, to pray for everybody there, but also for all the Gazans who are really putting their shoulder into helping their brothers and sisters. It takes a lot of courage.
And Shireen, how about in Bethlehem?
Well, I don't separate our staff from the community and all the people. We are part of this community and we witness what the others witness. So our staff are at risk as any other people. When they come to work, they might be faced by a checkpoint, or even during the Israeli forces in person, they might be in confrontation if they are coming to work, for example, and the forces are at the same invading the city, which happens very often since October 7. So they could be at any moment at risk, of being attacked or in harm. I don't see it as threatening or as severe as it is in Gaza, but still the numbers in the West Bank are still high. And as I mentioned, there is also the settlers attack. We don't only mean the forces, the Israeli occupation forces only. Also, we have the settlers attacks that might happen at any moment on the way to work. So this is what mainly is threatening our staff as the rest of the community.
I had a follow-up question for Shireen, and then I'm seeing some questions in the chat that some of them are for Bill and some of them are for both of you. But Shireen, while you're commenting, Bill already talked about, and obviously you're well aware of pretty much the destruction of the health system in Gaza. I'm wondering if there's any way that you see West Bank hospitals, obviously because of the geographical disconnect, I don't know what help can be provided. And I know obviously there's no traveling between Gaza and the West Bank for Gazans, but if you can just speak a little bit to what your own concerns are about the health system in Gaza and what maybe solutions you think there may be in the future.
Well, the most important solution is to cease fire. This is number one solution, and everything else comes later. If we stop the attacks, if we allow the international community or international organizations to interfere with the aid, this will help, of course. This is not enough. What we need is a permanent solution for this situation, because if this war ends without a solution, this will happen again. And this is what we all don't want. What we can offer, the Palestinian health care system is fragile even before the war, but we, of course, in a good situation to handle so many types of diseases and medical cases. So if this is allowed, of course, the hospitals of East Jerusalem and the West Bank are ready to receive, but this is not permitted or allowed. What we were able to offer only for less than 10 patients who got stuck here in the West Bank because they couldn't return to Gaza. There are 6 or 7 children with different diseases who, as I told you, were stuck here, and they come to CBH for follow-up. But that's all.
Okay, thank you. So I'll ask one more question, then Jeff, I'll shoot back to you, and I'm seeing more questions, so we'll try to get to as many as possible. But I was just going to combine a question, Bill, that I see here. Someone's asking about, when you're sharing stories with U.S. lawmakers, how have conversations gone? Do you feel like that's making an impact? And that kind of connects to a question that we had generally, that CRS, part of your mission is to do advocacy. I mentioned that we used to even do that together when I worked at CMEP. So maybe just speak to that advocacy mission. And I know many of the humanitarian organizations have spoken out about Gaza because of the connection between the delivery of humanitarian aid and the policy changes that need to be made in order to be able to do that.
Great, thanks. So, first of all, I think we've definitely had an impact in discussion with lawmakers, and I'd say CRS has tried to do a couple of things. One, being a respected organization with a long history in that part of the world and an experience in Gaza, just being able to explain to people, lawmakers included, that the Gazan population is not Hamas, that it is very possible to accountably deliver assistance in Gaza, and to kind of roll back some of the misunderstandings and myths that are out there about the nature of the population in Gaza. And I think that we've made a lot of progress, actually, on both sides in explaining those things, particularly around the supplemental funding package that just passed. There's a humanitarian portion of it, which we were working on. We weren't working on the military side, but on the humanitarian side. And I think we played a really important role in explaining that yeah, there's a lot of great work that can be done in Gaza that complies with U.S. law, and that and I think that's been very important. I think also, as the conflict has gone on, just the stories of our staff, what they're experiencing, what they're observing, has been very helpful, because, to be honest, there is a whole disinformation industry out there that is creating a very different narrative, that it's not so bad, that these are just the natural consequences of war and couldn't be avoided and all that kind of thing. And we've, I think, by bringing very concrete examples and stories and specifics, it's been quite helpful. And I think the passage of that supplemental funding is evidence of that. And I think, but we have a lot of work to do in the Congress for sure. In terms of advocacy, I mean, basically, the Catholic teaching around social justice requires you ask questions about the root causes of what is going on, of poverty, of war and conflict. And so that's when the long history of advocating on this issue with Julie, for example, is really trying to get at, like, how to lay the conditions for a just peace where 2 states, 3 peoples, or 3 religions living together in a situation of where so I think and that's what we need to do in the long run in order to address this conflict. So that's why we're advocating. That's, underlies everything we're doing. And it's partly why also calling for a ceasefire is something we've done since the beginning. And the Catholic bishops in the United States have issued several statements, all of which really essentially say the violence must stop now. And they are consistent with what the Holy Father is saying, that these problems do not have military solutions, and the violence needs to stop now, and calling for an end to the violence. So that's obviously the root of the human suffering which is going on and has been going on, and that's what we're advocating to stop.
Shireen, did you want to add anything to that before we go to the next question? Okay, you're muted.
Can I hear the question one more time?
Yeah.
Yeah, I had just asked just in terms of the connection between the advocacy work, which may not be as much of a focus for the hospital, but even from your own perspective, and the ability to really do your work, you know, to see that there needs to be policy changes. And I know you may not have direct access to members of Congress, but if you did, what would you like them to hear as far as the ability for you to do the work that you need to do to care for Palestinian people?
I think there is a lot to be told, and there is a lot to be heard. I think there are news. The news are available, and they have to look for the other story. This is very important, especially from the American politicians. You know, to hear the other story is very crucial in like forming the foreign policies in the U.S. Yes, this is my contribution. Yeah.
Thanks. So I want to take kind of a mix of questions here. One person raises the question, is Hamas embedded in the hospital? Which kind of goes, I think, to what Bill had said. There's a lot of misinformation out there. I'd like to ask first if either of you have any, you're, I'm sure, aware of the misinformation that's out there regarding many different things in the West Bank and in the Gaza. If there's any of those you'd like to address right now.
Go ahead, Shireen. Yeah.
Yes, I think also there is a misinformation, and this also affects the whole situation. What is requested and should have been done from early days is to have independent investigation, because you know this misinformation affects the public opinion and the political position. So what is missing is an independent opinion that could direct things, let's say.
Bill?
Yeah, I can just jump in. I think, I mean, I have no idea and can't verify anything about exactly who was in those hospitals or not. And I think Shireen's point about that's why there needs to be an independent investigation. What I will say, though, is that in international humanitarian law, destruction of hospitals and health facilities, particularly the way it's happened, is an extremely serious thing. And when an entire population is essentially being deprived of health care, that is a very serious problem in international humanitarian law. And so, and this question of proportionality, you know, Hamas is a serious problem. And what happened on October 7th of people just coming across and slaughtering people, children teenagers at a concert, you know, is utterly unacceptable. But that doesn't justify destruction of an entire health system that 2.3 million people rely on. And the targeting, this has been a big issue for us, all the humanitarian community, the sort of targeting of civilian and humanitarian targets, even those that have been clearly marked as such, is utterly unacceptable and has happened. The World Central Kitchen is just one of a long line of incidents that have happened where the Israeli Defense Forces was fully informed about what's going on at XYZ institution or movement of people, and yet still they were targeted. And the same goes for the hospitals. So.
Thank you. Julie?
Yeah, so there's another question here, and this may be more technical than you can get into. I think it's more for Bill, but maybe just you can comment on it in a general way. They're talking about something that's in the news right now, this national security memorandum related to the U.S. Basically, if a country that we give aid to is impeding access for humanitarian assistance, then how does that affect the U.S. government, providing that aid? And obviously this has been raised in regard to the U.S. military aid to Israel and the obstruction of access for humanitarian aid. So if there's anything you can say on that.
So the May 8th is when the administration is next to deliver a report to Congress with its assessment of whether Israel and frankly other governments, this is a National Security Memo 20 applies to all governments receiving U.S. military assistance. So it's an equal opportunity national security provision. And so we'll see what the administration decides on May 8th. I think that after the World Central Kitchen thing, and I say thing, just that's what came out of my mouth, but the brutal killing of those innocent humanitarian workers, the Biden administration insisted on specific, concrete, and measurable steps to and improvements in the humanitarian situation and access, protection of civilians. And I think what we would say is there's absolutely no doubt that for the last 6 months, assistance has been delayed, denied, stopped at various times in various different ways, and allowed in other times in other different ways. And whether the changes that are happening since then are enough and are sustained, we don't know. What we're asking for is we're not really interested in inputs. We're interested in outcomes. So until we see a reduction in malnutrition of children and adults, until we see no humanitarian workers being killed, until we see innocent civilians being protected, supplies being brought in at scale, sort of temporary measures are inadequate. So we're looking at the outcomes, not the inputs, and we hope the administration is as well.
That's really helpful. Yeah, Jeff.
Thanks. Shireen, this is a question for you. Could you expand on some of the challenges to the hospital as far as reimbursement? Because I know Caritas Baby provides most of their care for free, and some of the reimbursement comes from the people, some comes from the PA. Could you explain how that's been affected since the war in Gaza kicked off?
Yes, so we are an NGO hospital, and around 60% of our donations, of our income is donations, comes from donations. And mainly this is from Europe. So far, this hasn't been affected, but locally generated donations are affected because the focus now is on Gaza. And this could be, this is of course the priority, and we totally understand that. Now 40% of the income comes from the PA, the Palestinian Authority, UNRWA, and the uninsured patients. Now the PA and UNRWA buys our services as a pediatric medical center. So they, for example, buy the intensive care treatment, neonatal care, etc. Now, both the UNRWA and the PA suffer from financial crisis, which has been increasing after the war. And this, of course, the year is not over. The 2024 is not over yet. And the war happened by the end of 2023. So we cannot measure the impact very well now, but we assume that this will affect, of course, our income. Now, half of our patients, or more than half of our patients, do not have any kind of insurance, neither PA, the Palestinian Authority insurance, or UNRWA insurance. So they are offered not free treatment, but subsidized treatment. After the war, they couldn't even, some people could not even cover this subsidized amount of money. And here our social department interfered and helped, supported the families who cannot afford the subsidized treatment through financial support. And this is, of course, increasing, day after day, because Bethlehem now suffers as a result of, it is dependent on tourism, and we don't have tourism after the war, of course. So eventually this affects the economic and financial situation of the people in Bethlehem.
Thank you. Now, I know that's a special extra stress on the Christian community in Bethlehem. Bill, you had mentioned you can reach out sometimes, I think, to Holy Family Church in the north of Gaza, in Gaza City. And I was wondering if you could give us an update on their situation.
The Holy Family Church in Gaza City, the one parish in Gaza, there's, I don't know, maybe 800 Catholics in Gaza, something like that. I've been there a number of times. Fabulous parish. It's better than your parishes. Whatever parish you're in, it's better. Food's better. People are nicer. It's great. But I will say, when the war started and the attack on Gaza City came, and people were urged by the Israeli government to evacuate Gaza City, much of the Catholic and Christian population, as well as many of their Muslim brothers and sisters, sought safety at the Holy Family Parish and the Holy Rosary School and several other Christian facilities that the Orthodox Church and other Christian denominations have in Gaza City. Those people are still there. We have 3 staff actually from Gaza City, and they sought shelter in those compounds themselves. And so we hear from them about what's going on, and they are, as part of their job, they are providing, going out and finding and identifying sources of supplies to bring with our support into those compounds to help those people to the greatest extent possible. But they are, suffering along with everybody else. Those are some of the most, in some ways, safe locations in Gaza, in that we and others have, through multiple channels, made clear to the Israeli government and the U.S. government that these absolutely must be protected, these locations. And yet, several months ago, 2 women walking across the compound in Holy Family Church were assassinated by a sniper, Israeli sniper, on a nearby building. And a tank shell was fired into the Missionaries of Charity, which is on the same compound. Fortunately, the 28 severely disabled children and 34, I think, severely disabled adults had been moved to a different part of the compound, and nobody was harmed. But they are, it's rough. They're isolated. Many of them, during periods of semi-calm, have gone out and have reported back just the unbelievable destruction, the fact that their houses are gone. In response to a question I saw, they witnessed, kind of offensive graffiti that had been left by soldiers of the IDF in their own homes, and were deeply troubled by what they saw, and very concerned. Many of them have they really wonder what future they have, because as Julie said, 70% of the housing stock's been destroyed, and in Gaza City it's higher than that. So it's really troubling. But the faith of that community and their resilience and resistance continues, and CRS and certainly the Latin Patriarchate is assisting with Caritas Jerusalem.
I wanted to maybe build on that a little bit and ask maybe Shireen also to comment on this. There's a question in the chat about whether Israel is using Hamas's attack as an opportunity to accelerate a policy of ethnic cleansing. And specifically, there have been Israeli officials early on, and I'm thinking especially early on of saying, we would like the Gazans to basically leave, and, a kind of opportunity. There's been settlers who have also staked claims and said they'd like to have settlements back in Gaza. So I think there's also a misunderstanding in the American maybe media, but also public, about why don't Gazans just leave and go to Egypt? And I think there's so many complexities to that. I think obviously with the history of the Nakba and leaving and not being able to return. So I thought, Shireen, you might want to comment even just in a more broad way about fear for Palestinians when they leave their homes, being able to actually come back. But also, Bill, from a humanitarian perspective, for that many people, what is that, why haven't people left? What are the sort of issues around that? So maybe Shireen, if you want to speak to it generally,
Yeah.
and then yeah.
Yes, I think this can be true. Yes, I think this is part of trying to ethnically. This is what Israeli politicians say. This is not what Palestinians say. They want an exclusively Jewish state. They call it different. Different figures call for removing or reallocating Palestinians from the West Bank and the Gaza Strip. And I'm just saying what have been said on the media and publicly. So yes, and the last war proved that there have been attempts, the way the war started in the north, and people were expelled to the south, and now the south is threatened of, or is already being bombarded. This is all proof that there is sort of ethnic cleansing for the Palestinians, which is continuous. It didn't stop from 48,
Thank you.
So,
Bill, yeah.
Yeah, a couple things. One, we hear from our staff, they're afraid if they leave, they'll never be allowed back in, and this is their home. And so just like any of us, if somebody said, I could never go back to Chicago again, where I'm from, where my family is, it would break my heart, and I wouldn't agree to do it. From a humanitarian perspective, I mean, to move into Egypt, we're talking about the Sinai Desert, where there's nothing there. There's no provisions for them. And it's not Egypt's problem in international law. They have no responsibility to take, these people are not to go to Egypt. They're to be, according to international law, their needs are to be met by the occupying power where they are. And so Egypt also has, again, I'll just comment on the geopolitics of it. I mean, they're dealing with an insurgency in the Sinai Desert. It's not a secure area, frankly. And so introducing 1.3 million people, 2.3, whatever, into the desert with no provision in an insecure area is utterly irresponsible. And so from a humanitarian perspective, and I think the Biden administration gets this, it's a complete non-starter. From an international law and a justice perspective, it's also a complete non-starter. But it is something that a lot of people are worried about, and it's with the Rafah invasion, and I think it's one of the many reasons why we don't see how an invasion of Rafah, even if one believes that it's necessary from some military perspective to root out the leadership of Hamas, even if you believe that, we don't see how it can be pulled off in any way that won't result in the needless destruction of remaining infrastructure and the loss of many, many thousands of human lives. And so it's just not an acceptable option.
Okay, we have one final question, and it kind of is going to incorporate a lot of bits and pieces from different ones. Before we get into it, though, I did want to let people know, if you'd like more information about CMAP's work, you can go to cmep.org. If you'd like more information about Bill's organization, go to crs.org. And if you'd like to know more about Caritas Baby Hospital, you can go to caritasbabyhospital.org. So our last question is, what can American Christians, especially Catholics, do to support your work, of course, monetarily, but beyond that, from an advocacy and solidarity perspective? What would be, you think, most helpful for both of you? Thanks.
Shall I start? Yeah. So I think my request is not only from American Christians. I think it is, I think all people of faith should affirm humanity, justice, reject any action of injustice, and everywhere, not only in Palestine. You know, the whole world is on fire. That's how I see it. So it is our responsibility, if we want to be called Christians and people of faith, to stand by the weak, to stand by the one, and to reject injustice. You know, you cannot only, you know, solidarity is important, advocacy is excellent, but also we need action. We need change in decision making, change in foreign policies, more humanitarian intervention, and more impact on the injustice everywhere. I see that I like to quote Martin Luther King: injustice anywhere is a threat of justice everywhere. And this is why I see that it is our responsibility to reject it, to call for human rights and implementation of human rights, because we have human rights that are not implemented. Thank you.
That was great, Shireen. Thank you so much for sharing that. I'm going to start by just putting in a plug for the Caritas Baby Hospital. As I said, I would. I visited 2 years ago. CRS was supporting the Caritas Baby Hospital with its COVID response and was incredibly impressive. And really, the Caritas Baby Hospital provided the COVID testing for the entire half of the West Bank. And many, many lives were saved because of the work of Caritas Baby Hospital and the respect that Caritas Baby Hospital has in the community. It's an amazing facility, super professional and wonderful people working there. I can't say enough good things about it. In terms of this question of like, what can American Christians, Catholics do? I do think I'm going to start with what should be obvious, but prayer. And this is a very and I say that because I think we have to resist simplistic interpretations of what's going on and the history and the complexity. It is a complicated situation. You have strong feelings on all sides. You have there was some mention in the comments about, you have a group of people who experienced a very traumatic Holocaust, and then how does that trauma result in actions now, and how are people who are traumatized today going to act out in the future? And, you know, I think these are matters to start with by putting up to prayer, that all people, their hearts may be opened and their sense of empathy to their fellow human beings who are different than they. So that's for one. And I'm sorry to be preachy, but I think it's important. Second is, I do want to say, I think financial support for the Caritas Baby Hospital, for CRS, for any other credible organization on the ground providing assistance, I would encourage you to do. As I said in my opening remarks, there is a lot of great work going on, and we need your support. Others need your support. In terms of advocacy, I do think, contacting your representative and the White House and saying, one, I care about these issues. I care about a just solution to these problems. I want you to call for a ceasefire and hold the parties accountable to a ceasefire, and to do what you say you're going to do to negotiate a just two-state solution with the parties. And I think they need to hear from people. And I think reminding them that there is a constituency of Christians and Catholics who believe in justice and peace and want our government to act in that way and not cause more violence and more death and destruction. And then also CMEP, let's put in a good plug for them. And for you, thank you for pulling us together. And I think CMEP provides a forum also for folks to engage and get involved in the Middle East issues in support of the Christian community and other communities towards a just peace. So I'll thank our hosts before signing off. So thank you.
Okay, thank you, Bill, and thank you, Shireen, for laying a little bit of truth on us and giving us a clear, up-to-date, on-the-ground perspective. We can't ask for more. This webinar will be recorded. The links will be sent to everyone who registered for this, and we thank you all for joining us.
Thank you so much to both of you.
Thank you. Thank you for hosting.